For my policy topic, I have chosen to discuss what the impact has been and will be for raising the legal age to purchase and use tobacco products from 18 to 21. Tobacco use has always been a personal choice that individuals make. Tobacco use has also been a topic of debate for many years. There have been major concerns with public and consumer health, as well as the impact tobacco products have on our youth. Most recently, on December 20th, 2019, the President signed legislation amending the Federal Food, Drug, and Cosmetic Act and raised the federal minimum age of sale of tobacco products from 18 years old to 21 years old. It is now illegal for a retailer to sell any tobacco product, which includes cigarettes, cigars, and e-cigarettes, to anyone under the age of 21. In the United States, about 34 million U.S. adults smoke cigarettes. Every day, about 1,600 young children and adults under the age of 18 smoke their first cigarette, and nearly 200 begin smoking cigarettes daily. Over 16 million people live with at least one disease caused by smoking, and 58 million non-smoking Americans are exposed to secondhand smoke. From the consumer and tobacco industry's viewpoint, though, tobacco use is a choice that adults should be free to make. Throughout the years, tobacco companies have been instructed to provide warnings on their products pertaining to the chemicals, the increased risks for cancer, and how harmful tobacco use is to the body, as well as the harm of secondhand smoke, especially to children. Despite these warnings portrayed, consumers still choose to use tobacco products. By the recent legislation raising the age from 18 to 21 for the purchase and use of tobacco products, adults, being age 18, who were able to purchase and use are now being told they cannot. This is reminiscent to back in 1984 when President Reagan signed legislation that required all states to raise their drinking age from 18 to 21. And people between those ages who could drink under the old law were able to retain the right to legally consume alcohol under a grandfathered clause. There is no such clause enacted for tobacco products or the consumers, though. While ultimately this legislation will only reduce the tobacco product sales by 2%, the long-term effects to the tobacco industry could drastically cut consumer consumption. The Centers for Disease Control and Prevention is at the forefront of the nation's efforts to reduce deaths and prevent chronic diseases that result from tobacco use. The agency and its partners promote tobacco control interventions, including actions to prevent youth from starting to use tobacco, smoke-free environments, programs to help tobacco users quit, and steps to eliminate tobacco-related health disparities in different population groups. They are also behind raising the age to 21 because the reasons behind it is based on statistics and scientific research that shows that most young adults are exposed at an early age to tobacco use, usually because they are associated with someone who is of age to purchase and who can provide these substances to them readily. Research also shows that most young adults that don't start using tobacco products by the time they are 21 have a higher probability of never using tobacco products at all. The less exposure and experimentation youth have with tobacco products, the greater the health impact this legislation will have, as there will be less tobacco consumers and users as time goes on. It is well understood that tobacco use leads to disease and disability and harms nearly every organ of the body, that tobacco use is the leading cause of preventable death. The tobacco industry spends billions of dollars each year on marketing cigarettes. The tobacco industry now has limitations and is having to face regulation and legislation on other substances such as vaping products. Just recently in New York, the vaping industry took a hard hit as all flavored vaping cartridges and liquids were banned as it appeared to be marketed towards youth. Overall, the legislation on raising the age of tobacco use and purchase from 18 to 21 has already been passed. There are consumers that have been impacted, mainly those between the ages of 18 and 21. Unfortunately, statistics show that these tobacco users were most likely introduced to tobacco products before the age of 18. The purpose of this legislation is to improve public health and to put the brakes on preventable disease and death. By changing the legal age to purchase and use tobacco products, youth now and in the future will have a higher chance of never using tobacco products by the time they are 21, which will improve not only the odds that they will never use tobacco products, but their life expectancy and health will be better off as well. Thank you.